Hi, welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. Let's talk about your jawline today. Jawline reshaping has been a very hot trend in the past year in plastic surgery and in cosmetic medicine because there's so many different ways to give you a nice jawline. Surgically, of course, as a plastic surgeon, and then non-surgically. So let's take a deep dive into what helps make a jawline and the finesse of that. So, we'll talk about filler finesse because surgery, of course, is what I do every day in a facelift and neck lift. But how do you really define the jawline from the angle of the mandible to the chin length? And there are many different ways you can augment to that with a filler or fat, and I'm going to show you some ways to do that. And it really, when you have a good jawline, you really can improve the lower half of your face. So this is a 7-step technique for enhancing the jawline or the mandibular border filler. And I'm going to outline these on the jawline and how I blend the filler. I stay in the deep subcutaneous tissue, filling it from the behind the jawline to the anterior lateral chin, and then, of course, filling in the mandibular border as well. So I'm going to just show you, this is a contouring finesse video to show you exactly how I do it. And so this defines exactly the jawline, and I mark not only the angle of the mandible, but the mandible itself, and then the lateral chin hollow in this area, and then, of course, the vertical ramus as well. And then we'll begin the area where we're going to do the shaping and contouring, and that's very important because, in this case, we'll use calcium hydroxyapatite. This happens to be radius, and we'll do it in the deep subcutaneous tissue, and we'll shape and contour it in this area and really give you that border shaping that's very, very important in this area. And then, of course, we'll do the vertical component in the lateral cheek compartment. That's very, very powerful because not only do you want to get your border correct, but you also want to get your lateral portion correctly. And so you're going to do that as well as doing some on the gonial angle. That's really, really powerful to do with that. So we're going to do that, and then we're going to shape it as well and getting the front area done with hyaluronic acid filler. And we can add that in this area to complete that whole area in shaping of the mandibular border. So you've done the mandibular border, the angle, and the vertical ramus, and now you're doing the prechoral sulcus, and that's very, very powerful in this area. This is done with a blended HA hyaluronic acid filler. So you've really done the entire shaping and contouring, and then, of course, you do this bilaterally and symmetrically in this area, and you can see that you've really gotten some nice shape and contour in this area, and I think that's really very, very powerful to do. And you can do this with fat, you can do this with any types of fillers, and it really gives you a really shape and contour that you like. So this just gives you an idea. Here's some example of radius. This patient also had a rhinoplasty, but it really shapes and contours the jawline. And then this is actually her first phase, and then I'll show you an update where I did jawline contouring and a chin augmentation as well. So 7-step jawlining, and then, of course, here she is. Recently, she had some further jawline contouring and a chin augmentation. And here on the right, this is from her TikTok. She showed me what her chin looked like before, and here it is after on the left. And you can see she's got a beautiful jawline with some refinement of her jawline with further augmentation, in this case with fat and neck contouring, and then a chin augmentation as well. She looks beautiful. And you can see here she talks about it, and she's 4 months post-op, and she's an amazing patient, and she just talks about how her jawline has now been completely refined. She actually always would talk with her teeth pulled forward until she had a chin implant because of the fact that she was so subconscious of her small chin. So she shaped and contoured it, and now she has, beautiful aesthetics. You can see that her jawline is much more refined with her jawline reshaping with fat and neck liposuction and a chin augmentation. And you can see here she shows her pre and her post, and you can see it's quite dramatic. She loves it. So here A similar type of thing done with Renuva. This is an adipose-derived matrix, and again, same type of technique, doing along the jawline. This happens to be with another type of filler, and you're really shaping and contouring it with this area and doing this in a similar manner. Here's a patient that had jawline recontouring with Renuva, and she has a nice jawline shaping. This is done with another filler, Restylane Lift, shaping and contouring of the jawline. So the most important thing is be very systematic. If you're going to get enhancement of your jawline with a filler or fat, the most important thing is understanding the anatomy, but also what you're going to be reshaping. It's the vertical ramus, it's the angle of the mandible, it's the jawline and the prejaw sulcus, and then of course the mandible itself. These are all the components that really make for a beautiful aesthetic jawline. So know before you go, and good luck in your journey to seeking your best jawline ever. Give me your comments, give me your thoughts, and thanks for tuning in and subscribing to my YouTube channel and to my podcast.